Indeed, a sad situation there. Now, there are growing fears of a rise in HIV and other sexually transmitted infections as the country runs out of condoms. It is believed that this shortage of condoms is likely to promote the risks of unprotected sex amid increased HIV infections in the country. Individuals, particularly sex workers who are at high risk of being infected with the virus, are now forced to purchase the commodity that is selling at exorbitant prices. Agutu Rosa tells us more.
Correct condom use provides up to 95% protection against HIV and other STIs. VCT centers, which were once consistently stocked with free condoms, are now struggling to meet the demand, leaving sex workers grappling with the extra burden of purchasing the essential commodity. But now, supply is limited. Sharon Lona, a peer educator in Mombasa, says initially, sex workers would pick condoms at dispensers located at various points, including hospitals, but shelves remain empty.
Shortage ya condom, mimi ni peer educator. Sasa tunachukuanga hizo condoms tunaenda tunasupply kwa hotspots. Sasa venye kumekuanga na shortage as in peers wana complain. Kuna ma clients wenye watakangi kutumia hizo condoms. So ni risky tu.
A shortage of free condoms has left many unable to afford commercial ones. Commodity status report by the Ministry of Health highlights that as of November last year, there was a shortage of both female and male condoms. 31,067 female condoms were consumed monthly, 1,065,891 male condoms were consumed monthly, while in November last year, only 1,152 male condoms were available, while 0 female condoms were available. Kenya needs 450 million condoms annually, but relies on Global Fund, well-wishers and NGOs. However, condoms procured under Global Fund cannot be used in family planning clinics because of the fund restriction to only people living with HIV. An official from NASCOP who requested anonymity said the country has not been purchasing female condoms because their use remains very low. On male condoms, there's a supply, but limited following a drop in funding. Male condoms are available, but they are not as per the need. Distribution of the available stock has also been an issue. Some picking and dropping centers have been closed. National Syndemic Disease Control Council, NSDCC, insists on correct and consistent condom use. The council therefore acknowledges the importance of ensuring every sexually active person in Kenya has access to a sustained supply of quality condoms, correct knowledge, skills and motivation to use them correctly and consistently. Data from NSDCC shows that 19,991 new infections were recorded in 2024. Of the new infections, 4,345 were children aged 0 to 14 years, while 32% of all new infections occurred among adolescents. The condom demand in Kenya annually is 424 million. However, the government receives 180 million condoms annually from Global Fund and UNFPA support that has since stopped. 1.12 billion Kenya shillings is the amount that should be pumped into purchasing condoms in Kenya. Agutu Rosa, KTN.
Activist Mwabili